box section, and you'll get to know the right answer for this during the webinar from our esteemed panel today. So, the quiz question for today's webinar is: cervical cancer can often be prevented. Is it a true or false statement? You can share your answers in the chat box section. I can see. Let's see what's the right answer for this one during the webinar, and we'll be starting the webinar now. So, namaste, Sat Shri Akal, Salamu Alaikum, and a very fresh good afternoon, everyone. This is Sanghamitra leading the chronic condition program at MeraDoc, and I'll be your host for today. So, as you all are aware, MeraDoc is a 24/7 holistic, tech enabled healthcare delivery platform with family physicians as gatekeepers of the entire healthcare ecosystem. You all might be reading and hearing about cervical cancer a lot these days, and sometimes also wondering which information to trust. Cervical cancer is the second leading cause of cancer deaths among women in India, the reason being lack of effective screening and access to timely treatment, as we all know that. So, today we are here on this platform to know more about cervical cancer and its early prevention. For this, I would also like to thank MedTalks and Dr. KK Agarwal's team for supporting us. In the panel today, we have with us Colonel Dr. Sanjay Kumar Singh, who has specialization in family medicine and is currently the head clinical services at MeraDoc. Dr. Sanjay has 32 plus years of experience as medical officer and administrator and has served in various hospitals of armed forces all over India. He has also been a pioneer of medical mission in Afghanistan. We also have with us Lieutenant Colonel Dr. Archana Dalela, who has over 22 plus years of experience as family physician. Dr. Archana had also served as former Doctor Army Medical Corps. So, with this, I welcome both the doctors on the panel today. Thank you so much for taking out time and being on the platform for making us understand more about cervical cancer. So, Dr. Archana would be making us understand about cervical cancer along with its treatment, while Dr. Sanjay will help us understand the prevention practices. So, with this, we start today's webinar. Meanwhile, if anyone has any questions related to today's webinar, you can start sharing those in the chat box section. We will be covering all your questions towards the end of the webinar today. So, over to you, Dr. Archana.
Thank you so much, Sanjay, for the introduction. Today, I'll be telling you about something about cervical cancer, and I hope everybody is aware of this. But in general, we need to create some awareness. So, what is cervical cancer? Let me tell you about the cervical cancer now. Cervical cancer, as we all know, is the second most common cancer among women these days. Approximately every 40 minutes, a woman is diagnosed with cervical cancer. Now, what is cervix? Let me tell you that cervix is an important part of the reproductive system of a woman. Generally, we all know uterus, ovaries, fallopian tubes, cervix, and vagina. These form the reproductive system of a woman. What is actually cervix? Cervix is a tunnel like organ that joins the lowest part of uterus to the vagina. It has several functions. It allows fluids to pass through uterus and vagina. It is the common site of cell changes that indicates cancer. During menstruation, every month when the blood is shed, it passes through uterus, cervix, and then vagina. Cervix also plays an important role in pregnancy. It helps in passing the sperms while intercourse through the cervix into the uterus and from there to the fallopian tubes where the egg formation takes place. It also plays a major role in vaginal delivery. How does the cancer of cells in the cervix begins? Generally, we all know that our body is made up of cells. The cells present on the cervix start growing in an abnormal manner and they lead to the formation of precancerous cells that lead to the formation of cancer. This is the difference showing between a normal healthy cervix and a cervix with cancer. What is the anatomy of a cervix? As I told you, cervix is a muscular organ about an inch long that joins the uterus to the vagina. It is made up of basically four parts: the internal os, that joins the lowest part of uterus to the cervix, the endocervical canal, which proceeds from the uterus to the end of cervix, the ectocervix, and the external os. The external os joins the cervix to the vagina. The cervix is generally made up of two types of cells, the glandular and the squamous cells. The glandular cells lines the endocervical canal, whereas the squamous cells covers the ectocervix, cervix, and the vagina. There are various disorders of cervix, cervicitis, that causes the inflammation of the cervix, cervical dysplasia, in which the cells start growing in an abnormal behavior, cervical cancer. This is the topic of our today's discussion. Then there are cervical polyps and fibroids, cervical insufficiency, which leads to miscarriage and premature birth of a child. Then placenta previa. What are the symptoms of cervical cancer? In general, as we all know, when cancer is an early stage, it has got no symptoms. But later on, it gradually progresses and we see the signs and symptoms of cancer. In the initial stage, what a lady can feel is watery or bloody vaginal discharge, vaginal bleeding that can be seen after intercourse, between two consecutive periods, or after menopause. Menstrual periods can be heavy and they can last longer than generally a normal period. Once the cancer spreads to nearby tissues and organs, then the symptoms in addition to this are painful urination with burning maturation, diarrhea or bleeding from rectum, fatigue, loss of weight and appetite, pelvic pain or a dull abdominal pain. What is the general cause of cervical cancer? General cause of cervical cancer is because of virus HPV, that is also known as human papilloma virus. It is the commonest cause of cervical cancer and it generally happens because of sexually transmitted infection. HPV spreads through sexual contact that can be anal, oral, or vaginal. People who are seen to be very sexually active, they often generally have this type of cancer because human papilloma virus, generally in the initial stage, appears and disappears on its own without causing any serious complication. But once the risk factors are there and a person is found to be sexually active, then this virus can cause a lot of infection that progresses and finally lead to cervical cancer. There are few risk factors that are seen to cause cervical cancer. HPV infection, that I've already told you, lack of regular cervical smear test. This should be done like in the form of screening. When there is no screening, the cells at the cervix start growing in an abnormal way and they can lead to the formation or development of cancer, I should say. Generally, we say that the screening should start at an age of 21 years, but it becomes mandatory after 35 years of age that at regular interval of time a lady should undergo a pap smear test, which can help in diagnosing the development of changes in the cells of the cervix. If there is a family history, like mother or a grandmother has cervical cancer, then the chances of it developing in the daughter becomes more prominent. It is generally seen that the persons who smoke, they are more prone to get HPV infections, and as such, they are easily into the development of this cancer. Persons who are having weak immune system, mean to say they are already suffering from some autoimmune disease, they are also easily prone to get infected by this HPV virus and again leading to the development of cancer. Ladies who generally take a lot of birth control pills for a longer period of time, they are easily infected and they can develop cancer. Even women having multiple children or multiple deliveries, I should say, they are easily prone to be a case of cervical cancer. How can we diagnose cervical cancer? Cervical cancer can be diagnosed by three ways. Cervical smear, that is the pap smear. In this, the cells are sprayed from the cervix with the help of and they are then observed under the microscope to check for any changes found in it. Cervical biopsy. In cervical biopsy, a small piece of tissue is taken. This is known as punch biopsy, and this tissue is then tested under the microscope for the changes in the cervix. Colposcopy is instrument with the help known as colposcope, with the help of which a doctors find with the changes that are seen in the cervix and the cells are studied under the microscope. These tests helps us in diagnosing the cervical cancer. Now I'm going to tell you about the stages of cervical cancer. There are four stages of cervical cancer. Stage 1, in this the cancer is localized to the cervix only. It doesn't spread and is small in size. In stage 2, the cancer spreads beyond the cervix and extends up to the uterus, but it doesn't move up to the pelvic wall or the vagina. In stage 3, the cancer spreads to the lower part of vagina, pelvic wall, ureter, and the lymph nodes. The stage 4 covers the cancer up to the urinary bladder, rectum, and other parts like bones and lungs. This is the stage in which metastasis develop and the cancer is spread to the whole part of the body. Treatment. Treatment of cervical cancer is done by radiation, chemotherapy, surgery, targeted therapy, and immunotherapy. Now I'll be telling about each of one in detail. What is radiation? Radiation therapy uses energy beams to kill the cancer cells on the cervix. Any cancer that is in the early stage and the one that has not extended beyond the cervix can be treated by radiation. Radiation is generally of two types. One is external beam radiation therapy, in which a machine is used that aims to the radiation from outside the body onto the pelvis and to the particular area on the cervix. The brachytherapy that puts the radiation in or just near the cancer. Chemotherapy. Chemotherapy, in this, the drugs are generally injected into your veins or taken by mouth to kill the cancer cells. Several drugs are used for chemo and are given in period of cycles. Now, the length of the cycle and frequency of chemo depends on the drug used and the location of cancer. Surgery. Surgery includes radical trachelectomy. Generally, it depends on which part of the cervix the cancer has spread. In the case of radical trachelectomy, removal of cervix, part of vagina, and the lymph nodes around the pelvis is done. It is excised and the cancer is removed. Total hysterectomy. In this, there is removal of cervix along with the uterus. Treatment also depends in case a lady doesn't want to get pregnant in future. Like in case of total hysterectomy, there is no scope of pregnancy in the later period. Radical hysterectomy. In this, the removal of cervix, some tissue around the cervix, the uterus, and part of the vagina is removed. There is a process called salpingo-oophorectomy. In this, the removal of both fallopian tubes and ovaries are removed since the cancer is seen to be spread upon these areas. As we all can see, total hysterectomy is the removal of complete uterus along with the vagina and fallopian tubes, ovary, cervix. This is a subtotal hysterectomy. And in case of the removal of both the ovaries and fallopian tubes, it is known as bilateral salpingo-oophorectomy. There is a procedure called laser surgery. In this also, there is a laser beam that burns off the cancer cells. The cervix is exposed to laser beams and the cells that is undergone abnormal changes are burnt off by this. Cryosurgery, in this, the cancer cells are frozen up. Another process known as cone biopsy, it is a type of surgery in which a cone shaped piece of tissue is removed from the cervix. In this case, the healthy tissue is left over and only the exposed or the damaged tissues are removed. This, in general, is the treatment that is generally given for the cervical cancer. And now I would request her to proceed further for prevention part.
First of all, a very warm welcome to all our listeners who have devoted their valuable time today to listen this valuable topic, which is a topic of concern for the our all loved ones, basically the females, which is our backbone of our home, basically. So whenever we listen a term cancer, we all are shattered, we all are scared. This is not with the general population, I mean to say, but this is with even though the doctors also. This is not a very pleasant word to listen by the doctors also, the cancer. Cancer itself is a very painful word to listen. And the good thing and the best thing is that the cancer which we are discussing today, cervical cancer, it can very well be prevented by the measures which I'll be explaining you right now, how to prevent this cancer. So if the opportunity is there, if we can uh, save the life of any one person, whether it's a male or female, by cancer, we should do it. We should certainly prevent that cancer to anybody. So there are two major tools to prevent this cancer. One is the, as you know, as their lecture, the Dr. Archana also told you that this cancer almost 90% is caused by human papilloma virus. So we have a vaccine. The good news is that we have a vaccine for that, human papilloma virus vaccine. If it is given at the right age, then this can be prevented. Almost it can be prevented. And if suppose you miss that chance to take a vaccine, then there are pap smear or cervical cancer screening program is there, in which we take a smear from your cervix and we diagnose it at an early stage, so that you can be treated very well, because this cancer is also very treatable if we diagnose it at an early stage. Then it is totally curable, basically I will say almost curable, if we can diagnose it at a very early stage. So with this, I'll tell you, even the persons, even the ladies who have taken human papilloma virus vaccine, they have to also go for cervical cancer screening program as per the age recommended, which I have shown it here. The vaccination can be given from 9 years of age to 45 years of age. Uh, Basically, it is given in the period when the woman is sexually active, because then they are exposed to this human papilloma virus infection. I'll tell you one thing more. uh, Human papilloma virus this infection, the all females usually in their age, in their sexually active age, almost all women are exposed, and 90% of them, they develop this infection. But this is not that severe strain of the virus which is causing infection. There are so many strains of the virus, human papilloma virus. The strains 16 and 18, I will tell you, this causes cervical cancer. So, not necessarily that every woman who is infected with human papilloma virus will get the strain 16 or 18, which causes cervical cancer. But even if they get this virus infection, our body mechanism is like that 90% of women, they are able to develop antibody against it, and they destroy this virus also. But if we have taken vaccine, we are totally sure, 100% sure, that they can take care of, because antibody already formed. When you have taken vaccine in your body, already the antibody is existing. So, from the very early stage of infection, your body is capable of fighting this virus infection. So, if any lady who has taken vaccine, they are certainly no doubt, even if they are exposed to 16 and 18 strain also, they can be prevented by for having a cancer, cervical cancer, in their life. Cancer, cervical cancer screening is program. I'll let you in details later in my slide. First, I'll let you know this. Uh, this is the HPV vaccine. Basically, I told you there are more than 100 strains of viruses, human papilloma viruses, and other strains they cause other cancer also, like oral cavity cancer in male, also the penile cancers, anorectal cancer in both the sexes. This is also caused by human papilloma virus, and the very common word which must a lot of people must have experienced it also, the cauliflower like growth in their genitalia or somewhere else. Sometimes they must have felt. This is also caused by human papilloma virus, though this is not carcinogenic, basically this variety, but it can make changes, it can make mutation in the genes and can cause cancer. So with this, I'll tell you this: we have two vaccines available with us. The Servavec, which is being manufactured by Serum Institute of India. This is the India make vaccine, and this contains 16 and 18 strain, which I was talking about. This is the strain which is the culprit, which causes almost 80% of the cervical cancer is caused by this strain only. The less virulent strain is 6 and 11. So this gives protection with all these four strains. The another comes Gardasil 9, in which these four strains are there, but apart from that, other strains which cause other cancer in the body, like anorectal cancer, which I told you, penile cancers, and mouth cancers. This also other cancer can also be prevented by this. This is a bit costly. This comes more than 10,000 rupees one injection cost, but this cost in between 2 to 3,000 rupees. This its cost is low basically. So vaccine is a very easy shot. Uh, this is a simple shot of vaccine, simple shot of injection, which is given at the upper arm of your body, and it doesn't cause any problem, and it is not very painful also. But there are few side effects which I'll let you know. The people can have this side effect, not necessarily that everybody will have a side effect, but few people can experience it. So the common side effect which is being experienced by the vaccine taker, they are basically nausea. Nausea is basically vomiting sensation, malaise, body ache sensation, pain at the injection site. Sometimes the swelling at the injection site, mild fever. This can occur, but few can develop more severe symptoms like dizziness and fainting, but this occurs in a very few. The serious side effect with any vaccine always remains is the allergy to vaccine. If somebody is having allergy to some other vaccine also, the probability is that they can have allergy with this vaccine also. And for that reason, we usually what we do, whenever we give vaccine, we tell the patient to sit over there for 20 to 30 minutes. And usually any serious reaction is visible, or we can notice this serious reaction within 20 to 30 minutes in a patient. After that, they can be allowed to go to the home. So I was talking about the another who the ladies who miss the opportunity to get the vaccine. Even if they have got the vaccine also, then also it is recommended to go for cervical cancer screening. And in this screening, what we do, the this is done at the gynecologist clinic only, and in this they do the visual inspection of the part. The gynecologist does visual inspection, and they take a smear, pap smear. And how this left hand side I have shown you the diagram taking the pap smear. So don't go by this, it looks very complicated, but this is very easy process, I can say. This is one of the easy process. We all have experienced in the COVID time. Once we all have given the sample for COVID infection, and you have seen that they use a sample stick in which at the one end there is a cotton end is that which is being inserted in deep into your nostril or in the mouth to take the sample. In the somewhat similar sample stick is this also, but this doesn't contains the that cotton end, but it has a brush at the end, and it is inserted deep into the vagina, the uterus where the it projects into vagina. The part is called cervix, and from there it is being taken. This sample is being taken, and then we study this sample whether there are changes going on in this cervix or not. Even if you find there is a abnormal reading on pap smear, it doesn't mean that you will have a cancer. So the only thing is that we recommend to go more often for pap smear, but not necessarily that one abnormal finding in pap smear you will develop cancer. You need not to be panic for that, because sometimes the our body fighting system mechanism is there, and they fight against all these nuisance also, and then patient with the own defense mechanism or immunity, they don't develop the cervical cancer. And this pap is smeared from 21 to 30 years. When the lady is sexually active, from 21 to 30 years, they should go on every 3 years for pap smear. And after 30, they should go for 30 to 65. We recommend cervical screening program for female from 30 to 65 years of age. And during that visual inspection, the pap smear is taken. But after 30, we recommend HPV DNA test also. So each HPV DNA test will show whether the your cells are infected with that virulent type of HPV DNA or not, which causes cervical cancer. And if you go for both these tests together, you have to go for screening every 5 years, not on 3 years. But if you go only for pap smear, even after 30, you have to go for come for screening on every 3 years. HPV DNA together with pap smear, lady has to go on every 5 years if everything is all right. But if you have some changes in your pap smear or something in HPV DNA test, then we recommend uh, more frequent visit to gynecologist to give your sample and HPV DNA test and visual inspection of the cervix. Uh, Basically, I will tell you, the Valentine days is coming nearby, and I recommend that everybody should gift this vaccine to their loved ones, whether they are having their wife, girlfriend, sister. They must gift this vaccine this Valentine Day to their loved ones. Basically, thank you so much, and I am open for the questions.
Thank you so much, sir, for making us understand about the prevention techniques. And thank you so much, ma'am, for making us understand about in detail about cervical cancer and the treatment options available. Requesting everyone, participants, if you have any questions, you can raise your hands or you can share in the chat box section. आपके अगर कोई भी सवाल है वेबिनार से रिलेटेड, आप अपना हैंड रेज कर सकते हैं, आइकन पे क्लिक करके या चैट में शेयर कर सकते हैं. हमारा पैनल बहुत ही खुश होगा आपके क्वेश्चंस का आंसर करके. We would be really happy to answer your questions. So you can start sharing your questions now. So meanwhile, we also had few questions shared before the webinar. We had few questions. So, ma'am, so you being a healthcare practitioner, how often do you see that women nowadays, since there is some improvement in education and awareness about cervical cancer, is there any increase in screening practices nowadays? Are women coming to get screened? Do you see an increase in
Uh,
that?
Yes, Sanmitra, I will definitely say a lot of many women they have started getting this vaccine given to their daughters. I have seen so many parents coming and they are starting giving this vaccination. So this shows that how much people have become aware about this.
Right, absolutely. And I think
We
these
still we
education.
need to make awareness in our population, because our most of the population lies in village. The even the education much more is not prevalent and lower socioeconomic group. The lower socioeconomic group is the one which go for multiple pregnancies, and so many things are there, exposure, sexual habits, all this which contribute to cervical cancer. So I certainly feel there is a requirement to have a awareness, because every we are having a very large number of cervical cancer patients in our India also. And I'll tell you one scenario also. When I was for the few years I was working with Mohalla Clinic also, and I saw patients coming with complaints which is reflecting toward the cervical cancer. And I'm really happy because in the metro city they have the chance to consult a qualified doctor, and they are when they are contacting us and we are sending on the right time to them, and they are being diagnosed also with the cervical cancer. I have so many cases I have sent in the hospital. They were diagnosed as cervical cancer. But still I will tell you know our system is like that. Everybody is not they cannot reach to the health institution. Even the government hospitals are very overloaded, hospitals are overloaded, and the awareness is not there. And they don't even afford to go to the private doctor. Whenever they have some symptoms, they go to quacks, and they go to even pharmacy for the treatment, like I have a loose motion, I have fever, give me some medicines, and I have a backache. They don't know backache is going. The lady with backache, the lady having heavy menses, the lady having bleeding after the act of intercourse. These are all early warning signs of cervical cancer, which has to be dealt with a qualified persons, and we are lacking this thing. So we need to have awareness, no doubt about it.
Absolutely, sir. I think awareness and education and these webinars do help us in spreading the word about these techniques and practices.
Certainly, certainly.
So, since at MeraDoc as well, we have certain special packages for corporates wherein certain blood tests and radiological tests are included. But do you think there is still, some lack in that sense that cancers should be screened in terms of cervical cancer, or the corporate should enhance their corporate packages to make sure that they get their employees screened effectively?
See, I told you we are working in a metro city, and I have seen in MeraDoc the corporate approaching to us for investigation. I'm happy that everybody wants that Pap smear should be included. They want uh, that awareness is there. Even for the breast cancer awareness, also I'll tell you they are aware. They ask for mammography. Uh, but thing is that they don't know the right age, and then they start saying, okay, mammography we want also by the age of 30. And we actually we let them know that you don't require a mammography at the age of 25 or 30 unless until you have a genetic risk factor, or somebody in your family is having breast cancer, you have a history of breast cancer, then also then must you should go for that. But no, because it has also its radiation effect, so we don't recommend to them. And but that I will say that awareness is there, and whatever investigation we are receiving to get it done from MeraDoc, at least the Pap smear is included for female employees that I have seen. Since they are working in a higher corporate areas, and we are in a metro city, this must be the reason. I don't know about the other cities basically.
Sure, sir. Uh, Ma'am, we have also heard that, and we also have this information that breast cancer can be, genetic or can be hereditary related to certain specific genes. Does that also stands true for cervical cancer as well? Like we talked about the risk factors, but can we say
Yeah,
that cervical cancer is hereditary or no?
yeah, definitely, Sanjay. Family history plays an important role. As I told you, like a mother is having cervical cancer, then the possibility of the daughter having is uh, increases, and that's why screening is important. Because obesity and all, and if she's also involved into a lot of sexual activity, then infection through HPV becomes common. And although, like I told you, that at times HPV infection occurs, but yes, it is not so serious that it will result in a cancer formation. It often disappears on its own if it's mild. But yes, if a mother is having, though, there are possibilities of a daughter to have this cancer. And that is why we advise that screening should be done regular basis.
Sure, absolutely. Any questions from anyone in the audience? Anyone wants to have or wants to get an answer to the question that they have been holding upon? You can share in the chat box section, or you can raise your hand. We have the panel today to answer all your questions.
One thing more I will like to add on,
Yes, sir.
Sangamita. We should encourage parents also to get their children vaccinated, because this is the right age of the for this cervical cancer prevention. Vaccination is from 9 years to 16 years is the right age basically. And when the woman becomes sexually active, the chances of protection goes down. So we should encourage our parents to get their children vaccinated to for developing this cancer in the future, because this is the preventable cancer and very well we can prevent it if we have done the right thing at the right age.
Absolutely, sir. Thank you so much for adding that valuable point that awareness is not just for us; it's also for the future generations. It's also for our children. So it's a responsibility for ourselves as well as for our children to make sure that while we are getting screened, even if we haven't taken the vaccine, we should get screened, and definitely we should make it possible for our children to get the vaccine at the right age to prevent it. Prevention can only happen if together we can work towards it. It's not just the medical practitioners responsibility, but our responsibility as well, that if we have a vaccine available, why not take advantage of it? So very well added point by doctors, our panel today. So any closing note, doctors, since we don't have any questions as of now?
Uh, my earnest request to all listeners is that protect your family with this cancer by vaccination and by screening also. So even if your mother, suppose your mother is less than 65, encourage her to go to the gynecologist clinic once for a screening for pap smear or visual examination by a gynecologist, since she has not been vaccinated, because that awareness was not there earlier. So they should really become proactive, whether it's a male member or as a suppose a leading female member of the family. They should come forward and to prevent this cancer, not only in the family, but they should also uh, uh, propel this awareness to the society, to the nearby, who they like, even the maids which they are coming to their home. They don't know, they don't get this opportunity to listen this webinar also. So we must educate to them also to go at least once for pap smear and vaccination if possible. If we can take the responsibility of getting our maid also vaccinated, there is no harm in helping somebody. If you can prevent one person to have a cancer, this is the best thing in the life which you can give to anybody, that you have protected that woman from a cancer, which can be prevented very well. So for the maid also, I'll tell you that we should come forward to get them vaccinated. We should contribute the money to them so that they should not develop cancer, that they should not become burden to our society also. And there is nobody to look after them if they develop all these things. I'm sure they will be running here and there in the government hospitals. They will not get the time, they will not get the appropriate medicines also, because every medicine is not available in a government hospital. The only consultation can be given. But our population is so poor, they cannot buy the this costly medicine, which the chemotherapy, what Dr. Archana was telling, and the radiotherapy, it is not affordable to them. So take care of your family, take care of your society, and take care of your the persons who are coming to work for you, whether it's a babysitter, whether it's a maid. Make them aware for pap smear, get them vaccinated by your with your own pocket. There's no harm in benefiting them. Thank you so much.
Thank you so much, sir, for adding that valuable point. Over to you, ma'am. Any closing note from your side?
Even I would like to add on with this. Like, we often generally get some tests done only when we start feeling some symptoms. Like, if a person starts having chest pain, then they only will go to the doctor to get an ECG done. But this should be
Very
avoided.
true.
We should
Very true.
not wait. We should not wait that something develops and then only we get the test. So this should be, as sir has told, that pap smear should be done regularly. If anything, annually we should get our blood test also done so that we can come to know of any deviation in the blood parameters also. So this is my request to you all.
Absolutely. Thank you so much, ma'am.
Very good point, Dr. Archana, and it should be done. I appreciate.
Absolutely. And this is why, for the audience to know as well, we have this family physician concept at MeraDoc. A family physician becomes your friend, understands your entire family's history, and then suggests you specific steps, specific prevention practices, and screening techniques that you should undergo. So make sure that you make your doctor a friend, not someone who you are scared of and you only approach when you have some issues, as doctors mentioned today. And definitely be aware, make everyone aware about these screening practices. It's not just for you but for your future generations as well. So if there are any questions that is still unanswered, if you have any questions that are still not answered and you want the right person to answer your questions, you can reach out to us at MeraDoc. You can uh, look out at our website, and we would be really happy to help you with any of the healthcare options or healthcare services needs that you are looking out for. So, with this, we come to an end to today's webinar, and we would be certainly conducting many more such educational and informative webinars for you to understand, to get the right information, because in today's world, there are so many myths and rumors being spread. So, we take the responsibility to spread the right information, and so that we are able to guide you in the correct manner. So thank you so much, Dr. Archana. Thank you so much, Dr. Sanjay, for coming on the platform today and talking about cervical cancer, which was the need of the hour. Thank you so much.
Thank you, Sangha.
Thank you.
Thank you so much.
Thank you so much, everyone. Please, keep spreading the word, and we would be certainly making you aware and inform you about the next set of webinars.